So the reason that we need to do procedures in or around the sinus is where the bone between the mouth and the sinus, which sits just here underneath the eye, is reduced. Dental implants, as I'm sure you know, sit within bone tissue, and implants are usually 8 millimeters long or longer. There are some instances where we can use shorter implants, but on the whole, the traditional way of placing implants in the back of the top jaw when there is less bone is to augment or do some sinus surgery of some kind. Broadly speaking, there are two ways of doing it. The first, if we have just slightly less bone than we need, we can go and we can stretch the sinus floor from inside the preparation of the implant itself. So often the drilling will be done slightly short, and then either an osteotome, which is a little spike that's tapped into place, or a little balloon can be inserted into that site, lift the sinus floor for the implant to be installed. If you have even less bone, so 3 millimeters or less of bone in the area, then we tend to have to do what's called a lateral window sinus graft. This is where a cut is made in the gum and the gum is lifted a little higher up than normal. A small window is made in the side of the jawbone. It's only tissue paper thin in that area, so that's a very simple thing to have done. And then the membrane that sits inside your sinus is lifted away from the skull. The analogy to think of is like a cardboard box with a balloon inflated inside it. We make a little window in the cardboard box, lift the balloon away from the cardboard box, place some bone into the space that we make, and then often, in about 80% of cases, we can actually place the implant in at the same time as well. It sounds a lot scarier than it is.